Ngayong hapon po ay kasama natin si Mr. Kelly Bird, ang Country Director ng Philippine Country Office, Southeast Asian Department ng Asian Development Bank, upang pag-usapan ang ating bagong tayong Molecular and Diagnostic Pathology Laboratory sa JB Lingad Memorial General Hospital. Siya po ay naging country director noong 2018 at dala po niya ang higit sa 10 taon na karanasan sa iba't ibang bansa sa Asia sa regulatory governance and reforms, financial sector development, trade and investment policy at marami pa pong iba. Mr. Kelly Bird, good afternoon. Thank you for taking the time to be with us today. How this facility will help DOH with its targets for testing?
Okay, well, definitely, as you know, the Department of Health's target is 30,000 tests per day by the end of the month. This lab has capacity of about 3,000 tests per day. So it's now up and running, and we expect it to be at its full capacity within a month. So it will have a big contribution towards helping the Department of Health meet its 30,000 tests per day target.
That's great. The 3,000 tests per day that JB Lingad will be contributing will be of great help to the cause and the objectives of the department into reaching this 30,000 tests by the end of May. So we have heard that this laboratory can still do other things aside from testing for COVID-19. Is that right, Mr. Bird?
Yes, this lab will be a permanent lab at the Jose Lingard Hospital. So it will continue to test, samples beyond this pandemic. But, the hospital is also a teaching hospital. So it makes a lot of sense for this lab to be a research lab. So it will also serve to research on other viruses, genetic diseases, and also research into cancer. So it does play a very important role in the hospital's teaching component going forward, in the long term.
So this is really important, Mr. Bird, that it is not just supposed to be a COVID testing laboratory for the Philippines, but also after the pandemic, it will still serve some other purpose for the Philippine healthcare system. And this is something very important because it's going to study on other diseases aside from these emerging infectious diseases in the country. Among the different areas in the country, Mr. Bird, why did you choose Pampanga to be the location of this huge laboratory?
Well, of course, we took our guidance from the Department of Health, but there were 3 or 4 reasons why we were very keen on setting up the lab at the Jose Lingard Hospital in San Fernando City. The first one, of course, is at the time, Region 3 had the second highest number of confirmed cases. And so clearly a lab was needed to serve Pampanga and the surrounding region. The second reason is that the hospital is a high-quality public hospital. It's got over 250 beds. It's a teaching hospital. So we considered this hospital to have the capacity to quickly scale up testing. Finally, over the long term, it's important to have, this hospital will be important to Pampanga and the region, and it's always important to expand its facilities. So including a state-of-the-art lab, it's going to better serve the population in Pampanga. I also have a personal reason why I was happy to see this hospital get the lab. Over the past, we've had a number of projects in San Fernando City. I very much like the city. I've always had pleasant experiences there. We have a number of projects like our youth employment program. We're also doing a lot of infrastructure projects like our Malolos Railway project. And so I think it was just a lot of satisfaction to see that we're also able to help the region in the health sector.
That's great. Very much agree with you, Mr. Bird. Region 3 is one of the bigger regions here in the country. And currently, with the COVID-19 cases, we also are having increased number of cases in this area. So I think Pampanga is a very appropriate location for this huge laboratory. So can I ask if ADB is still looking at other facilities or still looking at, or are there any plans of building this kind of facilities in the other areas of the country in the future?
Yes, absolutely. We're discussing with the Department of Health right now a $125 million project to scale up the health response against COVID. We hope that this project will be approved next month. It will include 2 new labs, and these labs will be state-of-the-art biosafety and biosecurity standards. The project will also include training the lab technicians in the use of the equipment, and they should be, again, we hope that they'll be up and running fairly quickly. But this project, this $125 million project, not only includes those 2 labs, but it also includes scaling up testing kits, equipment, supplies that will be distributed to other public hospitals. It will also include renovating and constructing new isolation wards at selected public hospitals. So it will be quite a comprehensive project supporting the Department of Health scaling up its response.
I think this is great news for the Department of Health as well as the whole of government of the Philippines and of course our citizens here in the country, because with what you have said as to your plans of building additional facilities like this and helping with our isolation facilities, this will contribute more to the objectives of our department in our response to COVID-19. So as we all know that the facility has already been licensed, when do you think that it will start its operations?
On Saturday, I joined my Vice President, Ahmed Sayed, and also my colleague, Gerard Sabat, to join the launching of the lab. That day, Secretary Duque announced that the lab received its license. It's now been fully accredited, so it can start business. And we've provided all the training. The lab is now staffed with well-qualified trained technicians. So we would expect that the lab should be running at full capacity of its 3,000 testings per day, running at 2 to 3 shifts by within a month.
This really is great news, Mr. Bird. So with that, any more messages, especially to the Filipino people, please?
Yes, I do have a number of messages. I think I have, say, 3 or 4. And the first one, of course, is, right at this moment, it is important to continue to support the Department of Health in scaling up testing and contact tracing to reach that 30,000 tests per day. Evidence overseas shows that those countries that have been successful have done massive testing and contact tracing. I think, over the longer term, ADB would like to continue to work with the Department of Health. This has been a great partnership. We want to continue that, and we want to work with the Department of Health to build a strong health system ready to meet the next health crisis by focusing on implementing the universal health care law. So I think that would be important in the longer term. But I have 2 other messages. First of all, I really do want to commend the Department of Health, the government of the Philippines, for its decisive actions in fighting this virus. It's taken a very comprehensive approach, scaling up its health response, fiscal programs that have helped to transfer funds to vulnerable families. And I think with this, including the enhanced quarantine that was implemented in March, all of these actions together has helped the Philippines contain the pandemic and prevented the Philippines from experiencing what we've seen in other countries. So I think, the Philippines should be very proud of that. But I also want to commend all Filipinos. Everyone has made sacrifices in the last 2 months, but it's been one big collective effort by all 108 million Filipinos. So it's truly been a team effort. So you should be very proud of what you have accomplished so far. But it's far from over. It's kind of like climbing a mountain. You've climbed, you've got to the top, you've got to the summit, you've hoisted your flag, but you've got to come down. And that slope is very slippery. It's got its risks. So there's a lot more work to be done. You've got to still keep those numbers low. You've got to prevent a second wave. But at the same time, you've got to open up the economy towards that new normal. So I think if Filipinos continue to do what you really do well, and that's working together, I think the health system and the economy will come out much stronger.